Breast cancer is cancer that develops in breast cells and is the most common type of cancer among women. About 1 in 8 women are diagnosed with breast cancer during their lifetime. There's a good chance of recovery if it's detected at an early stage. In this video, we're going to fully cover everything about breast cancer and talk about its causes and risk factors, symptoms, stages, diagnosis and treatment. But first, if this is your first time in Risite channel, make sure to subscribe and turn on the bell so you're aware whenever we have uploaded a new and useful video. Most women diagnosed with breast cancer are over the age of 50, but younger women can also get breast cancer. Cancer occurs when changes called mutations take place in genes that regulate cell growth. The mutations let the cells divide and multiply in an uncontrolled way. The cancer forms in either the lobules or the ducts of the breast. Lobules are the glands that produce milk, and ducts are the pathways that bring the milk from the glands to the nipple. Cancer can also occur in the fatty tissue or the fibrous connective tissue within the breast. Now let's talk about causes. After puberty, a woman's breast consists of fat, connective tissue, and thousands of lobules. These are tiny glands that produce milk for breastfeeding. Tiny tubes, or ducts, carry the milk toward the nipple. Cancer causes the cells to multiply uncontrollably. They do not die at the usual point in their life cycle. This excessive cell growth causes cancer because the tumor uses nutrients and energy and deprives the cells around it. Breast cancer usually starts in the inner lining of milk ducts or the lobules that supply them with milk. From there, it can spread to other parts of the body. Some of the most important risk factors are: age. The risk of breast cancer increases with age. At 20 years, the chance of developing breast cancer in the next decade is 0.06%. By the age of 70 years, this figure goes up to 3.84%. Genetics. Women who carry certain mutations in the BRCA1 and BRCA2 genes have a higher chance of developing breast cancer, ovarian cancer, or both. People inherit these genes from their parents. A history of breast cancer or breast lumps. Women who have previously had breast cancer are more likely to have it again than those who have no history of the disease. Dense breast tissue. Women with more dense breasts are more likely to receive a diagnosis of breast cancer. Estrogen exposure and breastfeeding. Extended exposure to estrogen appears to increase the risk of breast cancer. This could be due to a person starting their periods earlier or entering menopause at a later than average age. Between these times, estrogen level body weight. Women who become overweight or develop obesity after menopause may also have a higher chance of developing breast cancer, possibly due to increased estrogen levels. High sugar intake may also be a factor. Alcohol consumption. A higher rate of regular alcohol consumption appears to play a role in breast cancer development. According to the National Cancer Institute, studies have consistently found that women who consume alcohol have a higher risk of breast cancer than those who do not. Those who drink moderate to heavy levels of alcohol have a higher risk than light drinkers. Radiation exposure. Undergoing radiation treatment for a different cancer may increase the risk of developing breast cancer later in life. Hormone treatments. According to the NCI, studies have shown that oral contraceptives may slightly increase the risk of breast cancer. According to the ACS, studies have found that hormone replacement therapy, specifically estrogen-progesterone therapy, is related to an increased risk of breast cancer. Breast cancer symptoms. In its early stages, breast cancer may not cause any symptoms. In many cases, a tumor may be too small to be felt, but an abnormality can still be seen on a mammogram. If a tumor can be felt, the first sign is usually a new lump in the breast that was not there before. However, not all lumps are cancer. Each type of breast cancer can cause a variety of symptoms. Many of these symptoms are similar, but some can be different. Symptoms for the most common breast cancers include a breast lump or tissue thickening that feels different than surrounding tissue and has developed recently. Breast pain. Red, pitted skin over your entire breast. Swelling in all or part of your breast. A nipple discharge other than breast milk. Bloody discharge from your nipple. Peeling, scaling, or flaking of skin on your nipple or breast. A sudden, unexplained change in the shape or size of your breast. Inverted nipple. Changes to the appearance of the skin on your breasts. A lump or swelling under your arm. If you have any of these symptoms, it doesn't necessarily mean you have breast cancer. For instance, Pain in your breast or a breast lump can be caused by a benign cyst. Still, if you find a lump in your breast or have other symptoms, you should see your doctor for further examination and testing. Types of breast cancer. The most common kinds of breast cancer are invasive ductal carcinoma. The cancer cells grow outside the ducts into other parts of the breast tissue. Invasive cancer cells can also spread or metastasize to other parts of the body. Invasive lobular carcinoma. Cancer cells spread from the lobules to the breast tissues that are close by. These invasive cancer cells can also spread to other parts of the body. There are several other less common kinds of breast cancer, such as Paget's disease, medullary, mucinous, and inflammatory breast cancer. Ductal carcinoma in situ is a breast disease that may lead to breast cancer. The cancer cells are only in the lining of the ducts and have not spread to other tissues in the breast. Breast cancer stages. A doctor stages cancer according to the size of the tumor and whether it has spread to lymph nodes or other parts of the body. There are different ways of staging breast cancer. One way is from stage 0 to 4, with subdivided categories at each numbered stage. Stage 0. Known as ductal carcinoma in situ, the cells are limited to within the ducts and have not invaded surrounding tissues. Stage 1. At this stage, the tumor measures up to 2 centimeters across. It has not affected any lymph nodes, or there are small groups of cancer cells in the lymph nodes. Stage 2. The tumor is 2 centimeters across, and it has started to spread to nearby nodes, or is 2 to 5 centimeters across, and has not spread to the lymph nodes. Stage 3. The tumor is up to 5 centimeters across, and it has spread to several lymph nodes, or the tumor is larger than 5 centimeters and has spread to a few lymph nodes. Stage 4. The cancer has spread to distant organs, most often the bones, liver, brain, or lungs. Diagnosis of breast cancer. To determine if your symptoms are caused by breast cancer or a benign breast condition, your doctor will do a thorough physical exam in addition to a breast exam. They may also request one or more diagnostic tests to help understand what's causing your symptoms. Tests that can help diagnose breast cancer include mammogram. The most common way to see below the surface of your breast is with an imaging test called a mammogram. Many women aged 40 and older get annual mammograms to check for breast cancer. Ultrasound. A breast ultrasound uses sound waves to create a picture of the tissues deep in your breast. An ultrasound can help your doctor distinguish between a solid mass, such as a tumor, and a benign cyst. MRI magnetic resonance imaging combines different images of the breast to help a doctor identify cancer or other abnormalities. A doctor may recommend an MRI as a follow-up to a mammogram or ultrasound. Breast biopsy. If your doctor suspects breast cancer, they may order both a mammogram and an ultrasound. If both of these tests can't tell your doctor if you have cancer, your doctor may do a test called a breast biopsy. During this test, your doctor will remove a tissue sample from the suspicious area to have it tested. There are several types of breast biopsies. With some of these tests, your doctor uses a needle to take the tissue sample. With others, they make an incision in your breast and then remove the sample. Treatment. Treatment will depend on several factors, including the type and stage of the cancer, the person's sensitivity to hormones, the age, overall health, and preferences of the individual. The main treatment options include radiation therapy, surgery, biological therapy or targeted drug therapy, hormone therapy, chemotherapy. Factors affecting the type of treatment a person has will include the stage of the cancer, other medical conditions, and their individual preference. Surgery. If surgery is necessary, the type will depend on both the diagnosis and individual preference. Types of surgery include lumpectomy. This involves removing the tumor and a small amount of healthy tissue around it. Mastectomy. A simple mastectomy involves removing the lobules, ducts, fatty tissue, nipple, areola, and some skin. In some types, a surgeon will also remove the lymph nodes and muscle in the chest wall. Sentinel node biopsy. If breast cancer reaches the sentinel lymph nodes, which are the first nodes to which a cancer can spread, it can spread into other parts of the body through the lymphatic system. If the doctor does not find cancer in the sentinel nodes, then it is usually not necessary to remove the remaining nodes. Axillary lymph node dissection. If a doctor finds cancer cells in the sentinel nodes, they may recommend removing several lymph nodes in the armpit. This can prevent the cancer from spreading. Reconstruction. Following mastectomy, a surgeon can reconstruct the breast to look more natural. This can help a person cope with the psychological effects of breast removal. Radiation therapy. A person may undergo radiation therapy around a month after surgery. Radiation involves targeting the tumor with controlled doses of radiation that kill any remaining cancer cells. Chemotherapy. A doctor may prescribe cytotoxic chemotherapy drugs to kill cancer cells if there is a high risk of recurrence or spread. When a person has chemotherapy after surgery, doctors call it adjuvant chemotherapy. Hormone-blocking therapy. Doctors use hormone-blocking therapy to prevent hormone-sensitive breast cancers from returning after treatment. Biological treatment. Targeted drugs can destroy specific types of breast cancer. Treatments for breast and other cancers can have severe adverse effects. When deciding on a treatment, people should discuss the potential risks with a doctor and look at ways to minimize the side effects. Now, what is the outlook? A person's outlook with breast cancer depends on the staging. Early detection and treatment usually lead to a positive outlook. According to the ACS, a person who receives treatment for stage 0 or stage 1 breast cancer has a 99% chance of surviving for at least 5 years after being diagnosed, when compared to women who do not have cancer. If breast cancer reaches stage 4, the chance of surviving another 5 years reduces to around 27%. Regular checks and screening can help detect symptoms early. Women should discuss their options with a doctor. We hope you found this video useful, and if you did, hit the like button and be sure to subscribe. Tell us in the comments which topic we should go after for our next video.